Hello, I'm Mabel Jong, and you're watching continuing coverage of World Healthcare Congress 2012. What will it take for healthcare providers, from hospitals to doctors to clinics, to fully embrace and accept technology? I'm here now with Dr. Peter Tippett of Verizon Enterprise. Dr. Tippett, good to see you.
Thank you. Nice to see you too.
Well, we certainly have the fundamental building blocks. That does exist, but widespread adoption does not. Why is that?
Well, there's two big problems, I think. One of the things that in healthcare we've been very worried about privacy and security. So much so that a doctor would never email another doctor medical records, even though the financial institution would gladly email you a mortgage application and the response of that. So in other industries, we've had pretty strong adoption of even sensitive use of computers. In healthcare, we've been much more worried about that. And one of the Verizon's solutions for all of that is to provide the kinds of mechanisms that just make compliance and security and privacy easy. Verizon bought CyberTrust several years ago. That was the biggest security services company in the world. And now we've taken that technology and combined it with some of the other platforms and cloud computing and whatnot. And now we've got a layer we call the exchanges layer, whose whole purpose is to make it so that a gizmo can talk to a doctor or to a cloud service and keep it all safe and secure and compliant, just to make that compliance problem go away.
So the concern about hacking into someone's records and that kind of threat is less now with this new technology?
Hacking is real, and gosh knows it's increasing every year in both in healthcare and other industries. And so it's appropriate to worry about security appropriately. But it is also slowing us down in making, in getting all these systems connected. Doctors all have for 30 plus years been dictating whenever somebody gets admitted or discharged or transferred or procedures or whatever. There's 2 or 3 billion dictations done a year, but 97% of those make it to the next doctor on paper or fax. They don't stay digital. Just keeping the stuff that's already digital, keeping it digital would be a big step, and making it so that it's safe and secure. So, for example, it's quite possible for you to use your iPad to have a video conversation with your sister about her new, diagnosis. But it's not legal for you to have such a discussion with your doctor unless the whole thing is HIPAA compliant end to end. That's one of the things Verizon can do is provide the mechanism, whether you're using Verizon's network or not, to make the exchange of that information safe, secure, and compliant.
And are you confident that that is a missing piece in terms of getting people better outcomes from their care and the speed of treatment?
The bottom line is that the vast majority of medical information doesn't move from one place to the next. Computers are being used very well as long as you stay in one place, but as soon as you move across town or across the country, it doesn't get there. So we wind up with huge cost overruns. A third of all tests that people get are done again by the next doctor because they never saw the first one. It's a simple matter of getting them visibility to it.
Well, what happened to the first one?
It's there. It's just not available to the next person. It's not easily, they can't click and get it.
Okay.
And so little things like just making it possible, it seems silly.
It certainly
given all the connectivity we have in all the rest of our world, that we don't have the same level of connectivity in healthcare.
How long will it take to get that connectivity? It's
coming pretty rapidly. We have all the building blocks, as you said, to make that thing work. One of the things Verizon's also added is we run the identity ecosystem for a big part of the world. We run it for the Veterans Administration and the White House, and for Belgium and Hong Kong and Singapore and whole countries. And oddly enough, knowing John Smith from John A. Smith from John Adam Smith, or which patient is which, is tricky. And to the extent that we can provide those unified mechanisms and what we call universal identity, and we can build that in and make it easy for everybody to use, all of a sudden the systems that need to share this information won't get the wrong Betty Boop's information in your medical record.
Okay, very interesting. Thank you, Dr. Tippett.
You bet. Thank you.
I'm Mabel Jong. Thanks for watching.